Hello and welcome to the Midday Update. Here's the latest update from our newsroom. Starting with the first story that just came in from the Ministry of Health, it has announced the death of 2 residents with coronavirus in Oman, aged 54 and 67 years old. This takes the total toll in the Sultanate to 25 death cases. The officials has extended its deepest condolences to the family of the 2 deceased. The Ministry of Health on Monday announced the registration of 193 new coronavirus cases in the country. 72 of the new cases are Omani nationals and 121 for non-Omanis, bringing the total number of coronavirus cases registered in the Sultanate to 5,379. According to the Ministry of Health, this number also includes the recovery of 1,496 and 25 deaths. The ministry urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health, as well as staying at home and not going out unless necessary. The Ministry of Health's Department of Blood Bank Services at the Directorate General of Specialized Medical Care renewed its appeal to those recovering from COVID-19 to donate immune plasma after it was proven to be effective as a supportive treatment for some cases. This is because of an increasing demand for the blood plasma due to the increase in the number of patients in hospitals. Dr. Zainab Salim Al-Uraimi, Director of Blood Bank Services Department, explained in an interview that many recoveries responded to this call and took the initiative to donate plasma at the department's headquarters in Boshar. Plasma donation appointments have also been scheduled with a number of recoveries so that the department can provide it to health institutions continuously, where this treatment is provided to patients in referral hospitals based on the evaluation of the attending physician. The Civil Service Council has announced that there will be a new salary structure for those who will be appointed to work in Oman's government sector in future. According to Resolution 3/2020, the salaries awarded to new employees will be according to the professional degrees they hold, as part of a unified salary structure for Omani civil servants in the country. According to Article 1 of the resolution, appointments for those who enter the government in new entry-level roles will be done on the basis of those qualified to meet the requirements of employment, in terms of the grades specified for the academic requirements for these jobs. Article 2 cancels those decisions that contradict the above, and Article 3 says that this decision will be published in the official gazette and will be enforced from the date of its publication. In addition to that, we have Dr. Zaid Al-Hinai, Assistant Professor and Consultant Pediatric Infectious Diseases from Sultan Qaboos University, joining us, who is going to talk more about coronavirus and its impact on children. Thank you so much, Dr. Zaid, for joining us. Hello, Dr. Zaid, can you hear me? Yes, thank you so much for joining us today, Dr. Zaid. So we'll start with the first question here. Why are there varying numbers in coronavirus cases on a daily basis? Dr. Zaid, in your expert opinion, okay, yes. So, in your expert opinion, Dr. Zaid, do you think that Oman has entered the stage of getting peak cases, or is it yet to come? So, looking at the numbers on a weekly basis, do you think the numbers are concerning, or is it still under control? Dr. Z, talking about the symptoms that everyone should know, or the first signs that everyone should look out for, what would you suggest, and what do you have to say about it?
Yeah, it's a bit of a tricky virus. There are some symptoms that tend to highly suggest it. So if you've had fever and cough and shortness of breath, definitely that's very concerning for having the coronavirus or COVID-19. There's also it's a wide range of symptoms though, and it can be very mild. One symptom that has been recognized more recently is interesting. It's a loss of sense of smell or loss of sense of taste. So if you all of a sudden you feel like you can't smell anything or you can't taste anything, That's actually suggestive of the COVID-19. And then you have the cough and the difficulty in breathing and fever. That tends to develop after a few days of milder symptoms. It gets really tricky when you go into mild symptoms because you can just have mild sore throat, some body aches, or low-grade fever, or some nasal congestion, or some diarrhea. All of these have been reported. Some people actually only get these symptoms for a day or two and it goes away. So you really have to be careful if you think you've been exposed and you have any even minor symptoms, you should get help and see if you should get tested.
Thank you, Dr. Zaid. And in terms, like you just explained about the symptoms, who are those who are more susceptible to the complications associated with coronavirus?
Yes. The truth is that everybody in all age groups are susceptible to the infection and severe complications and death. Nobody is really 100% safe. There are some groups that have been having higher percentages of more severe disease, and these are the elderly above 60 or 65 years of age. Also, people with underlying illness like chronic lung disease or people smoking chronically. Also, diabetes, high blood pressure, heart disease. Also, recently recognized in the US was obesity. So, being overweight significantly may also increase your risk of severe disease. But really, everybody should be very careful. Nobody is really safe. Even in children, more is being recognized about severe disease.
Talking about children, Dr. Zaid, how common is COVID among children, especially in Oman?
Yeah, that's a good question. The estimates we're having so far is that approximately maybe 5% of the infected of the cases in Oman are actually among children. So that's about 250 to 300 cases. Thankfully, the vast majority of them have been mild so far, and there's been very few hospitalizations, and so far no deaths among children in Oman, thankfully. But actually, a percentage of 5% infection among children in Oman is a little bit higher than what has been reported in other countries. And it might have to do with our family structure in Oman, which our families tend to have a larger number of children. In children also, there's a newly recognized syndrome now called multi-system inflammatory syndrome in children, and it's being associated now with COVID-19. And this is a very severe disease, although it is rare, but it's very severe. Children tend to need to be cared for in the ICU. It affects multiple systems in their bodies, like it can cause heart failure and other organ failure. There's been some deaths reported in Europe and in North America. This is a syndrome that seems to happen after the infection, not actually during the actual infection. It happens about 2 to 4 weeks after the child has been exposed to the virus, and seems to be a reaction of the child's immune system that is going above and beyond what is needed, causing this multi-system inflammation and symptoms. So parents need to watch out for signs of this, and that includes persistent fever that tends to be high and persistent for more than 3 days, in addition to other symptoms like red eyes, rash, skin or swelling of the hands and feet, or abdominal pain and diarrhea, or lethargy and inability to feed or decreased energy. I think if you're a parent and you're seeing some of these symptoms in your child, you should get help, because if it is this syndrome, we need to observe the child probably in the hospital and monitor closely and see what kind of treatment, which is usually mostly supportive, needs to be offered.
Dr. Zed, did you have any such cases of multi-system inflammatory syndrome in Oman lately, or is it just the cautious or the warning you're giving out to the parents out there?
So far, nothing has been reported, but this is very newly described, and our numbers of cases in Oman are still small. It's probably only a matter of time before we see some cases of this. It also tends to happen a little bit later. So, for instance, in the UK, the peak of cases they had was in late March, and then it's about a month later that they saw a peak of the multi-inflammatory syndrome. So we do want to put out a warning to doctors and parents to watch out for this. This is not only in children, it happens in adolescents too. So up to 19 or 21 years of age has been described. So even doctors taking care of adolescents or young adults should watch out for this. And parents also should seek help if their child is, say, having a fever for more than 3 days with some of the other symptoms like rash or red eyes, such. It is. We expect that we might see a few cases in Oman in the next month. So we have to watch out for it and be ready.
You mean next month, the cases of the syndrome you're talking about?
Yes, yeah. Probably given the numbers that we're having now, we might see we're probably going to see some cases of this syndrome in Oman. So that we have to be alert.
And when you're talking about children, Dr. Zed, what age bracket are you referring to?
Well, children goes up to 12 years of age, and then you have adolescents. So in some countries, everybody under 18 years of age is considered a pediatric patient. In Oman, usually we go up to 12. But this syndrome is affecting children of all ages. It's been compared to a disease that we know occurs in children, which is Kawasaki disease. But it is a little bit different in that this syndrome seems to be more severe, with more problems with the heart in terms of the ability of the heart to pump blood, and it also happens in slightly older age groups, which are most of these cases are above 5 years of age, whereas Kawasaki disease tends to happen in children younger than 5 years of age. But when we're talking about children, basically, we're talking about all age groups in children, and also we're including adolescents up to 19 years of age.
You mentioned that 250 to 300 children were tested positive with mild symptoms of coronavirus. So you were talking up to the age of 12?
Yes.
So what is the difference between the treatment of the adults and children when it comes to being positive with coronavirus?
That's a good question. The treatment in general right now is still what we call supportive, which means we support the body's function, hydration, control the fever, and support oxygenation, so the breathing. There still aren't very good proven treatments specifically for the virus, but there's a number of treatments that are experimental, and some of them have been showing some promise in clinical trials, some of them to a less degree, but these treatments are some of them are antiviral treatments like remdesivir. It recently got FDA emergency use authorization, which is not equivalent to an approval, but it is a green light to use it with a close monitoring of adverse events and reporting. Because remdesivir in one trial that hasn't been yet fully reported or published, but in preliminary data seems to might shorten the duration of illness. Another medication that has been used widely is hydroxychloroquine, which is also thought to attack the virus. However, the clinical trials on this have not really been very impressive, and we still need more data. Then there's what you talked about earlier, which is the convalescent plasma. This also started to be given in Oman recently, and convalescent plasma is still experimental, so it's not proven. It is showing anecdotally some good results in some cases, but this is not equivalent to saying it's a proven treatment. So it's being studied now in clinical trials around the world, and it is promising, and we hope it will work. And in fact, at Sultan Qaboos University Hospital, we've also now prepared the blood bank to receive donors. So you can donate if you've recovered from COVID-19. We do request you to donate either at the Central Blood Bank, the Ministry of Health, or to contact Sultan Qaboos University Hospital to donate there as well.
Thank you, Dr. Zaid. One thing that is very popular and very concerning is the use of appropriate masks. Everyone is going crazy over to know what exactly is the right mask to use. Could you please tell us?
Yeah, the masks are now, we used to say no need for masks in public places, but what has been recognized is that a lot of people might be carrying the virus with no symptoms or very mild symptoms. And in that case, wearing a mask in public does help prevent you from spreading that virus when you're in a public place, in case you don't know you have the virus. Obviously, if you have symptoms like a sore throat or fever or cough, diarrhea, you should stay at home. You should be in isolation. You shouldn't be interacting with people. But if you do not have symptoms, wearing a mask in public is recommended, especially if you're going into closed places, into supermarkets, into shops. Wearing a mask will stop you from transmitting the infection to others. And it may also potentially, plus or minus, might help you a little bit preventing the infection. That's not really proven very well. So any simple mask that will basically cover your nose and mouth, can be a cloth cover, should do in public. The N95 mask is really needed for very small, closed places where the patient is being subjected to aerosolizing procedures. So that's usually in the hospital, where you need the N95 mask, where you're really close with the patient and the virus is being aerosolized. This doesn't happen really significantly in public places. So if everybody were to just wear a simple mask in the public, that would be very good.
We are moving towards the end of our show, Dr. Zaid, so I'll quickly ask you if you would like to give out a message to people, especially the parents of the young kids.
Yeah, the message is that although the majority of infections in children are mild and will pass, we should still be very careful and not expose our children to any unnecessary risk. So we should be role models for the children in terms of social distancing. Children learn best by role modeling. We should be role models in hand hygiene. And then when we're going outside, we really shouldn't take our children with us to public places, because children, when they go to public places, they tend to run around and touch a lot of things, and they could easily pick up the virus at the supermarket or at other places. Also, children and neighbors playing with each other, that's another way that the virus can transmit from one family to another. Playgrounds as well. So we have to be really careful for ourselves and our children's sake.
Thank you so much, Dr. Zaid, for another informative session with us and amazing tips.
You're very welcome. Thank you for having me.
For all the viewers and listeners out there, thank you for tuning in. Make sure to stay home, be safe, and keep watching TTV.